Hi, I'm Jason. On behalf of my colleagues at New Cross Hospital, I'm presenting this quality improvement project where we looked at improving the perioperative anaesthetic practice in hip fracture patients at New Cross Hospital. So we all know that hip fracture patients carry a very high risk of mortality, and they're often very complex and challenging patients to deliver anaesthetics to. The AAGBI, NICE, and the Anaesthetic Sprint Audit of Practice have all released guidelines relating to the anaesthetic care in hip fracture patients. So we therefore decided to audit our anaesthetic practice against these national standards. So to do this, we collected data retrospectively for 100 patients between January to April 2019, and the results were quite surprising. We often found that there was a considerable deviation from the recommended guidelines and a very clear lack of a standardized approach. In particular, we were finding that patients were having a GA more often than a neuraxial anesthesia, and with the GAs, the majority were having IV inductions rather than sort of a gas induction. Similarly, with the intrathecal techniques, we were using a lot more than 10 milligrams of bupivacaine, and we were often using intrathecal diamorphine rather than fentanyl. In terms of sedation, this was also very variable, with most patients actually receiving opiates or a combination technique of various agents. And lastly, there was quite variable use in terms of nerve blocks, as well as incidence of hypertension being quite significant, probably related to the fact that a lot of the patients were getting IV inductions and GAs. So to resolve this, what we decided to do is create an anaesthetic pro forma, which we can use in all hip fracture patients, which is detailed in figure 2. So you can see that the first part of the form looks at mortality using the Nottingham hip fracture score, and in doing so, it's hoping to highlight areas which can be used for patient and family discussion, as well as informing the perioperative plan for this potentially complex patient. In terms of the latter half of the document, it has various anaesthetic prompts which will hopefully guide the anaesthetist on the day to obey and stay in line with the current guidelines, but in the same way not becoming too exhaustive and too dictatorial. So in doing this, we hope to reduce, as I said, the variation in the care given and achieve the high levels of safety and performance in line with the current guidance, given the considerable hazards and operational complexity of dealing with these challenging patients. And this is currently being implemented after a delay due to COVID, and we will of course re-audit in due course. Thank you for listening.